Dear colleagues, on behalf of United Cities and Local Governments, the City of Guangzhou and the Guangzhou Award for Urban Innovation, we welcome you to this session. Before yielding the floor to the opening remarks of the session and our Secretary General, allow me to let you know that we have interpretation in English, Chinese, French, and Spanish. Please go to the bottom of your screen to select the language you want to hear. We ask all speakers to put the interpretation enough when speaking in order to avoid glitches with interpretation. Welcome everyone. Secretary General, Dr. Nicolas Yu, the floor is yours.
Thank you very much, and thank you all for joining us here today. We are unfortunately still experiencing all of the problems dealing with COVID here in Europe, and we are looking with much envy towards what is happening further east, where apparently cities and countries are coming out of the COVID crisis. I have great honor today to invite the opening remarks by the Secretary General of UCLG, followed immediately by the Secretary General of Metropolis and by Mr. Gao Yuyue, Deputy Secretary General of the Guangzhou Municipal Government. So without much further ado, I would like to give the floor to Emilia. Emilia, you have the floor.
Thank you very much, Nicholas, and welcome everybody. Thank you for joining this World Council Week. We are delighted to have you joining the deliberations. Innovation has always been very high on the agenda of the collaboration between Guangzhou City and the international movement of local and regional governments. When the Guangzhou Award started, we were looking at innovation from a perspective of new tools, digital innovation. We were having a very specific focus in mechanisms and tools. I would say that since the adoption of the Sustainable Development Goals and the 2030 Agenda, the Guangzhou Award proved to be a very good environment to foster the promotion of these global agendas at local level. This is something that the Guangzhou team saw very timely. And then the next step for us was to ensure that whatever we learned in this very intensive and very open process of the Guangzhou Award was also transmitted and impacted in the learning agenda of our world organization, in our research and policy agenda, in all the work areas of United Cities and local governments. And that's where the creation of the Community of Practice came about. The Community of Practice is the link between the awardees and the world organization. It needs to be also the space where we are able to share in between awards the lessons that we have learned, but also where we foster updates about what are the approaches that we need to have in the next editions. And obviously, for next year's edition, I mean, the video that has been shown as introduction is very saying. Well, we will need to look at innovation in the context of COVID and what does it mean to all of us. Well, I think it goes much deeper than we ever thought. It will impact more areas than we ever thought. It will increase the urgency of many of the things that we knew. But above all, it has proven to be the transformation that we need has proven to be in areas that we had already identified and that have been awarded Guangzhou Awards before. So I am very excited about this session because I think as we look at the next edition in next year, And I really hope it can be a physical celebration that we do together. We need to discuss further about what those approaches are. There are three areas that are of big concern to our political leadership, to the cities, towns, associations that are members of United Cities and local governments. The renewal of decision-making process, the governance processes that we will need to develop in the face of this kind of crisis, the different relation that we need to have with nature, with the planet, and of course it is very much part and parcel of the green development, green sustainability that we need to foster, and finally also a new kind of multilateral system. The link between the local and the global is more relevant than ever before. Guangzhou, such an open city, a city of trade, has always demonstrated this, and we hope that this community of practice and the Guangzhou Award can continue to foster this global vision with local anchors, and foster solidarity among our membership. So I will stop here. Welcome everybody. Please let us use this space well.
Thank you very much, Emilia, for those opening remarks. I think you've really hit the nail on the head with so many of the issues that you brought up. I would like now to invite Octavi. You have the floor.
Thank you, Nicolas. Hello, everybody from Barcelona, and thank you for inviting me to be in the opening of this session as Metropolis, together with UCLG, as supporters of the Guangzhou Awards. I couldn't be more in agree with Emilia, with her words. I have a feeling that the Guangzhou Awards, lately I always say that when you are inviting me to your sessions, it's not only about the awards, it's the process. I mean, it's a process where the awards have kept evolving from the beginning, just to acknowledging good experiences, but as well the way it's connecting with the reality, with the global reality and the local reality, and the evolution that is witnessing. And as well, it's not about only submitting a proposal, it's all the work which is around, about connecting all the different actors, connecting the ideas, developing the knowledge that's based on the basis of these experiences that are awarded. And I think my feeling is that this is encouraging cities to develop new ideas. I had the feeling maybe at some point we should call these awards not only on urban innovation, but on urban creativity and innovation, because this is what I think is about these awards. It's not about just acknowledging what we already know is good, but as well acknowledging those cities that are taking risks, in terms of looking at new ways of doing things, and new ways of organizing, and new ways of developing policy and implementing this policy. We have this challenge. I mean, Emilia has highlighted some of the challenges. What is going to mean this green and digital society? I mean, how is this impact of the green and digital society going to have in the way that we are developing our cities? We know that some of the cities, some of the members of Metropolis and UCLG, but other cities around the world, they're experimenting and they are testing new ways of doing things. With the COVID, the pandemic, what we have seen is an acceleration of certain processes that were taking place in our cities. In terms of governance, the way that local leaders are doing the policy making, the way that services are being delivered right now, the way that leaders and local institutions are relating to citizens is completely changing. And that's something as well, I think that the Guangzhou Awards will be monitoring in the future. And I'm very happy to see that, I'm sorry if I'm repeating myself, how the Guangzhou Award has been connecting with all the work that's been done within the family of UCLG, with the different areas of work, as well with the different areas of work of the Metropolis, because I have the feeling that you are nourishing our debates. And beyond supporting the cities with knowledge, you are also nourishing our debates with concrete and specific ideas. So thank you very much, and I'm looking forward for the debates today.
Thank you very much, Octavi, for those very encouraging words. Indeed, that has been our objective from the very beginning, is how can we stimulate better ideas? How can we stimulate more in-depth discussion on what needs to be done in order to confront present day and future challenges? I would like now to give the floor to Mr. Gao Yue, Deputy Secretary General of the Guangzhou Municipal Government. Mr. Gao, you have the floor.
好，尊敬的赛制秘书长、德拉瓦加秘书长、邮件华顾问、各位来宾、女士们、先生们，大家好！欢迎来自世界各地的朋友们不容出席世界称帝组织世界理事会会议广州专场活动。我谨代表广州市人民政府向各位嘉宾表示诚挚的欢迎。当今世界正处于百年未有之大变局，面对人类生存环境的共同问题，全球城市急需积极应对，共同解决，迫切呼唤富有成效的城市治理交流平台。为此，广州市与世界称帝组织、世界大都市协会联合创设广州国际城市创新奖，激励和推动全球城市治理创新，至今已成功举办4届，每届均吸引超过50个国家近200个城市参加评选，已收录全球1000多个城市治理创新案例，获得联合国人居署等国际组织的高度认可与支持，已成为推动实现联合国可持续发展目标、落实新城市议程的重要平台。今年以来，新冠肺炎疫情在全球肆虐，给全球城市和地方政府带来了始料未及的严峻挑战。作为最早受到疫情影响的城市之一，广州始终不忘广州奖创设的初心，秉持广州奖推动城市经验交流和智慧分享的价值理念，主动参与抗疫国际合作，加强与世界称帝组织和世界大都市协会的联动合作，持续与全球城市交流分享疫情防控与经济复苏的做法和经验。今年以来，与举办和参加36场在线国际抗疫研讨会，并向有关国际组织和38个国家的49个城市分享抗疫经验，以实际行动表达对国际社会抗疫工作的支持。突如其来的新冠肺炎疫情，让我们更加深刻认识到，良好的治理能力和完善的治理体系是全球城市应对公共卫生等全球性问题的坚实后盾和有力武器。这也使我们更加积极地通过广州奖平台推动全球城市改善治理和可持续发展。今年以来，我们克服各种困难，全力推进广州奖各项工作。我们在阿布扎比第10届全球城市论坛期间，发布第4届广州奖优秀城市案例摘编，以线上形式发布第4届广州奖入围城市案例调研报告，并持续推动全球城市创新系统性研究和城市创新评价指标体系的构建，继续加强全球城市管理者和研究者的参与度，全面提升国际城市治理的经验交流和智慧共享水平。让我们倍感欣慰和鼓舞的是，我们的努力得到了国际社会的响应和支持。第5届广州奖共收到来自60个国家175个城市的273个项目申报，这充分体现了在疫情背景下，全球城市更加坚定改善治理的勇气和推动可持续发展的决心。今天，我们进一步围绕广州奖的价值理念和优秀参评案例，以疫情下的城市治理与创新 为主题举办专场活动，邀请有关城市和专家代表就后疫情时期如何通过城市创新实现社会经济恢复与可持续发展开展深入的交流与探讨。我们真诚希望各位朋友能畅所欲言，互通有无，交流城市抗击疫情的有效做法，分享城市开放创新的先进经验，共同为打赢全球疫情防控阻击战做出应有的努力，为推动实现联合国可持续发展目标，落实新城市议程做出更大的贡献。最后，再次感谢各位出席今天的专场活动，预祝此次活动取得圆满成功，祝大家身体健康，一切顺利。谢谢。
Thank you very much, Mr. Gao, for those words and also the actions that Guangzhou has taken in order to work in solidarity with cities around the world during these difficult times. I myself was in Nairobi a few months ago when several institutions in Guangzhou were sending masks over to Kenya and to other African countries, as well as protective gear. So thank you again, and I think Guangzhou has shown again that it is upholding the banner of international cooperation very high. This concludes our first segment, which is devoted to opening remarks. I hereby would like to open the second part of this event, which will be focusing on 3 panelists. We have deliberately made an attempt to bring cities to come and tell us their stories, but unfortunately one of the cities had to drop out at the last minute. But we do have the city of Xi'an with us today. And I have also asked 2 people to join us as experts, and these are not experts that are usually the ones that are gravitating around the Guangzhou Award. We've made an attempt to identify people who are new to this endeavor. Well, the first panelist is Mr. Jose Siri, Senior Science Lead for Cities, Urbanization and Health of Our Planet, Our Health program of Wellcome Trust. The second panelist is Dr. Mark Newinson, Director of Urban Planning, Environment and Health Initiative at IS Global Barcelona in Spain, right next door to UCLG and Metropolis. And our third panelist is Mr. Ron Pungbing, Deputy Director General of Xi'an Municipal Development and Reform Commission. So just as a brief introduction before I ask Jose to take the floor, I would just like to say that my personal experience over the last 9 months has been one, as my profession dictates to me, that we really have to re-examine how we live and work and plan our cities, right? I have many friends, colleagues, and distant family members who were caught in lockdowns and were really suffering very badly because of the way their houses or their neighborhoods or their streets were designed. So we need to re-examine how we design our living spaces. We need to rethink how we produce and how we consume. The entire supply chain was disrupted in many cases, and in some cases had become toxic. For example, with the meat processing plants, especially large-scale ones. Smart working is going to have many implications on how we experience the city. Public space, again and again, was a major issue that came up. How do we access it in times of crisis? How do we make it more accessible? And then, as Emilia mentioned, the relationship between the city and its inhabitants and nature. But I think also one of the biggest lessons coming out of this crisis is that we really have to put inequality at the very top of the agenda. In far too many cases, we've seen that it is the poorest of the urban populations, the immigrants, the minorities that suffer the most. So with those few comments, I would like to invite our first panelist. Jose, you have the floor.
Hi, Nicholas. Thanks so much. And thank you to UCLG and Metropolis for inviting me to this important discussion. I think it's an especially interesting time to be considering the role of urban innovation in making a better world. And so I want to talk briefly about COVID impacts and underlying causes and what I see as some of the most important opportunities in the recovery. And I'd first of all like to acknowledge my debt to colleagues in a recent WHO UN Habitat webinar on people-oriented urbanization, where some of these ideas emerged. So let me begin with a few observations about the vulnerabilities that COVID has exposed. First, we need to recognize that the virus emerged into a complex environment, not a neutral space. Every aspect of urban design, planning, and health, and COVID interacts with existing inequities and risk factors. For example, one study estimates that long-term exposure to air pollution increases risk of COVID mortality by 11%. Obesity may increase risk by 40% or more. And urban inequities play out not just in outcomes, but in risks and even in the feasibility of solutions. As Nicholas just pointed out, the poor are much more likely, for example, to have to continue to go to work and take public transport and thus to be exposed to the virus. Informal neighborhoods may be less able to implement control measures like hand washing and social distancing. In most contexts, marginalized individuals will have less access to insurance, to sick leave, to diagnostics, to therapeutics, and eventually to vaccines. So you have reinforcing feedback loops where inequities generate greater inequities. And all of these issues predate and exist independently from COVID. So what the pandemic has really done is to shine a light on our failure to design cities for health, which has implications for climate change and for other future shocks as well. Secondly, the crisis has exposed the fragility of our systems. So COVID has disrupted commercial, medical, and food supply chains. In some contexts, it's overwhelmed healthcare systems. In most contexts, it's led to massive unemployment. It's also posed serious challenges to specific economic sectors, including tourism and transportation, in ways that have in turn led to major financial issues for cities and local governments. Again, this fragility predated COVID. It's not new. These types of cascading risks were understood and anticipated, but the pandemic has made them much more visible and urgent. Third, we were significantly underprepared in terms of information and communication, governance, decision-making, and health resources, among other things. A few countries have handled the situation quite well, several in Asia, a handful of others around the world, but the vast majority have been caught flat-footed. And the same applies to cities and for global coordination. Again, these shortcomings aren't new, but they were hard to fully appreciate until we experienced a crisis of this magnitude. So if these risks that have amplified the impacts of COVID predate the crisis, then before we get to building back better, we have to understand why we haven't addressed them in the first place. And I think that there are several root causes. One is the tendency towards disciplinary and professional silos. Silos let us specialize and acquire deep knowledge. They let us communicate and collaborate more effectively within our fields, so they aren't all bad. But they do make it much more difficult to anticipate cross-sectoral impacts or to take advantage of synergies. Ironically, silos develop naturally as a response to complexity, but they make it much more difficult to appreciate its effects. This is especially important in the context of urban planning and management and public health, which emerged together at the birth of the modern city, but have drifted apart over the last century and a half. Another root cause is the tendency to focus on efficiency over resilience. Efficiency requires minimizing waste to maximize profit, whereas resilience demands redundancy and diverse approaches. This tension has especially played out in global business value chains, but it can be seen in decision-making at all scales. And a third cause is the tendency to discount future risks in favor of immediate needs. In the health sector, for example, just 12% of global spending is for preventive care measures like vaccination or health promotion, and the lion's share of spending for treatment. And this emphasis on cures, which are obviously squarely within the expertise of the health sector, probably also contributes to a failure to engage with prevention originating in other sectors. But this tendency to discount isn't limited to health. We see it reflected in short-termism across all sectors and in decision-making by governments at all scales. In the context of COVID, it probably plays a role in the premature reopening we've seen in many countries in an effort to restart economies. And certainly we see it in the context of delayed climate action. So to build back better, to have prosperous cities that promote health and sustainability and are resilient to COVID, climate change, and other challenges, we need to tackle these fundamental drivers. There are a number of ways to do this. Three critical ways are by restructuring incentives, recognizing and restructuring incentives, proactively shaping our institutions to achieve the results we want, and by finding consensus on how to measure progress. Specific solutions will always be local, but these general principles are likely to apply everywhere. So for example, to bring urban planning and public health back into legitimate partnership, we need to create new norms and rules that incentivize collaboration. So for example, legally requiring health impact assessments in planning decisions. We need new institutional structures and mechanisms to make working across domains easier. This could take the shape, for example, of interdisciplinary training programs. We need indicators that draw on the collective intelligence of both fields, like localized codes and standards for healthy urban planning. Now, I want to shift gears slightly and talk about what we're seeing specifically in COVID times. And COVID has brought crisis, but also possibility. And all of a sudden, we're seeing a landscape that demands innovation and that invites change. And I think there are a few key opportunities to keep in mind. One is the wide open space for creative experimentation in policy and practice. And we're seeing a flood of experiments in cities around the world, involving everything from repurposing streets and public space for active travel and commercial purposes, to a shift to telework, the digitalization of health data for disease control, shifting roles of government and society. And in many cases, these actions have benefits not only for COVID, but for other goals like climate mitigation or resilience, and that's very important. It's also true that small experiments can help identify promising solutions while bypassing some of the political barriers to larger scale action. Another opportunity is in the broad realignment of priorities that we've seen. It enables health positive interventions that we've long recommended from the health sector, but for which there was no political will before. This realignment is likely temporary, so right now is really a critical moment to make key structural and institutional innovations. A third opportunity is in widespread awareness of the costs of the pandemic. And in general, accounting for health costs can dramatically change the benefit analysis for planning and development actions. For example, the global value of health gains from climate action would be more than double the costs of mitigation. So we urgently need more health valuation in urban planning. And lastly, the financial and other challenges that cities are facing right now are a really strong argument for integrated action to leverage cross-sectoral synergies. This can take many forms, from participatory governance, where citizens play a role in decision-making and budgeting, to transdisciplinary research, which brings policymakers, professionals, and the public into the research process in service of societal goals. Transdisciplinary research has been one thing my program at Wellcome has focused on for years. So I will close by reemphasizing that in building back better, we need to first address the fundamental drivers that have previously hampered our efforts to build sustainable, healthy cities and societies. We need to address structural determinants of health and the incentives and silos that perpetuate them. And if we do that, then we'll be much better prepared to take on future challenges. Thank you.
Thank you very much, Jose, for that very comprehensive and compelling set of arguments on what needs to be done in order to build back better. I also participated in a WHO UN Habitat webinar, and it was really interesting to see that there is an emerging consensus that we have to get our act together. Right? And especially, I would say very importantly, how do we marry the long-term, the long time frame that urban planning usually requires with the short-term immediate responses that are required to respond to a disaster of this nature, but also the issue of how you hit it right on the nail. How do we measure progress? What are the key indicators of performance? Are they still cost efficiencies, as we have talked for decades, which have led to practically the emptying out of our health institutions and healthcare systems? Or is it some other set of indicators that we need to measure progress? Thank you. And now I would like to hand the floor over to Mark. Mark, who recently, by the way, published a book on city and the COVID-19 crisis. Mark, you have the floor.
Thank you so much, Nicholas, and great to be here. I did a little presentation. I hope it works here. Where Jose gave a fairly broad overview of different issues and very comprehensive. I focus in a little bit on this particular issue on mobility and public space, what have come up, what was always there. I mean, most cities are, there's always this competition for space that is out there. And of course, mobility is often a very important issue in cities. Now, the COVID pandemic has highlighted this even more, where some of the measures, as you know, is that the distancing measures, what's a good preventative measures, what requires more public space. And then also for mobility, where there is now a fear to use public transport, for example, because of the higher transmission risk, what drives people either to using more the car or sometimes using more active transportation, or what we always see for people to work at home. We know that urban and transport planning has a large impact on health. We did a health impact assessment here in Barcelona, what is kind of a modern compact city, high traffic density, where we found that 20% of annual mortality was due to factors related to urban and transport planning, including the lack of physical activity, high air pollution levels, high noise levels, lack of green space, and also heat island effects. You know what it is like in a city like Barcelona, only 1 out of 4 trips are by car, but 60% of public space is actually taken up by the car. And I think this is, you know, typically what you may see in many cities. And this is something that definitely needs to be addressed. Now, as part of the pandemic, we had the lockdowns, and different cities here in Europe responded in a fairly similar way, as they were trying to get cars out and people to use more active transportation. For example, like here Paris, where they let the cars out. London, where they made areas car-free. What we also saw, Milan, that announced this increase in cycling lanes, what we've seen in many different cities around Europe. And there were even a kind of talk of a cycling revolution, but it was increasing. Now, I think this is a bit exaggerated. There is an increase in cycling, but it's definitely not a revolution. But definitely there was more space needed for cycling, and cycling lanes have been put in there. Now, the thing is, we need to rethink our public space, and what I would like to present a 3 kind of different models, the way we could go, where we could reduce mobility to some extent, or move mobility from the car towards active transportation, and also increase public space. And the first example I would like to take is my own city here, Barcelona. It's a beautiful city, originally designed, or the extension of Barcelona, for health by Ildefonso Da. He had health in mind. That's what Jose said. Initially, the cities were designed with planners and health professionals together. But unfortunately, in the 60s, the cars took over and created a problem with air pollution, etc. Also, Ildefonso Da envisaged a lot of green space, particularly here in the middle of these blocks, but the space was taken over by other things, so no green space. So we have a very compact city with high air pollution levels, noise levels, lack of green space, etc. And the idea is now to change this model, what we have at the moment, what is on the left side of you, where we have one-way roads going up and down for traffic, into what we call super blocks. The idea of super blocks is using this grid system, cutting off 4 junctions in 9 blocks to create space for active transportation, walking and cycling, and also for more green space. And then have the motorized mobility going around this. That the idea is to create 500 super blocks in Barcelona. At the moment, we have 3 of them. And here is one example. For example, is the Sant Antoni super block. But the top one you saw what was before the intervention, and below what is after the intervention. Where you can see more green space, people opportunity to walk. I mean, there's the afternoon, not many people walking, but you see quite severe change. We also looked at this in terms of what would be the impacts on air pollution, noise, and green space, and found that there was a reduction of 20-25% in air pollution and cars, increase in green space, a reduction of surface temperature, and that these measures could reduce mortality by almost 700 per year in Barcelona using health impact assessment, what Jose was talking about as well. So this shows the use of health impact assessment to predict what may be the benefits and where the benefits are going to come from. In this case, the reduction in air pollution contributes to the largest reduction in mortality, premature mortality. Physical activity here is underestimated because we don't have any or not much data to go in for how the physical activity actually may change. Now, another model that is being promoted that's quite a lot of traction here is the so-called 15-minute city that's been promoted in Paris. And here is the idea that all your activities, your work, your school, your shops, your events are all within 15 minutes of your residence. Nowadays, you know, people often travel 1-2 hours to get to their work. This idea would be that things would be brought much closer together with reducing mobility and increasing the possibility for active transportation. Of course, this is a radical different use of the city that we're used to, because many cities are at the moment segregated by social economic status. And here, for example, would be you would be imagine that people of mixed background all live together. I mean, that in a way it goes back to our cities, what we were in the 300-400 years ago, where you had the poor people living at the bottom and the rich people on the top of houses, for example, getting this back. So this is the idea from Carlos Moreno from Paris, who is bringing in this. And I think it's a great idea to redevelop. The other thing, the model is what's being promoted as well, so-called car-free cities. We've seen in many cities that already that the center is becoming car-free and pedestrianized, and what makes it a much more pleasant area there, and it's got many benefits for health as well. What we see, for example, is that Hamburg plans to go completely car-free in 2034. Now, this is not for health, I must say, but this is for climate crisis reasons, where they want to reduce their CO2. But I mean, of course, there are many benefits there as well for health as well. Do you think it's possible? Yes, I think it's possible. I mean, if you look here, for example, a neighborhood in Freiburg, Vauban, is actually car-free. It's a fairly large neighborhood with sustainable housing, with a lot of green space. People cycle around to the city center, or there is a tram, and this really reduces car use. So this is a new model that other cities I know are actually looking for. Again, I mean, it creates more public space and also public space for people to be active. We recently did a couple of books around the topic, and as what Nicholas said, I just did a little one, COVID-19 in the City book. It's a kind of collection of different blogs that we wrote. I was a bit bored, so I started writing some different things, but it's kind of informative to see what kind of suggestions there are, how we could improve our cities for the future. as a result of the pressure that the COVID pandemic brings on. Thank you so much.
Thank you very much, Mark, for those very interesting examples of how cities can actually begin to envisage change. And I think that is very important. We very often forget that in order to present a convincing policy alternative, people have to visualize what the change implies, what it does to their daily lives, what it does to their lifestyles and livelihoods. So I want to thank you very much for those insights and inputs. Our last panelist is Mr. Wang Qingbing, the Deputy Director General of the Xi'an Municipal Development and Reform Commission. He will share with us some of their experiences in dealing with the COVID-19 crisis. Just to inform you, Xi'an is a city of about 8 million inhabitants in northern China. Mr. Wang, you have the floor.
女士们、先生们、朋友们，西安呢不仅是中国历史古都，也是中央政府确定的9大中心城市之一。也非常感谢国内外朋友长期以来对西安的关注和支持。今天我简要呢给大家介绍和分享一下复工复产的情况。 新冠肺炎疫情发生以来，西安市委市政府积极化危为机、危中寻机，围绕人财物有序流动、产供销有机衔接、内外贸有效贯通、统筹协调、扎实有序推进全市企业复工复产。 上半年，西安市生产总值、规模以上工业增加值，还有固定资产投资这3项指标的增速，都位居中国15个副省级城市之首，在中国最重要的30个城市里边，也是排在第1位。前3季度。 全市生产总值增长4.5%，增速高于全国3.8个百分点。那么，西安在推进复工复产这个工作中呢，主要有4个方面的特点。第一个呢，就是筹划部署突出3个到位突出3个到位。首先，第一个呢，就是 组织领导到位西安市成立了疫情防控指挥部在疫情防控部的统一领导下呢，我们又分市区2级，成立了复工复产组，组建了相应的工作专班，启动了缘起平台，最终呢形成了横向贯通、 纵向协同的组织领导网络。二是呢，就是方案措施到位。我们西安市研究制定出台了服务企业加强疫情防控、促进复工复产的这个工作方案在这个工作方案的指导下呢，我们来开展复工复产工作。三是呢，在工作机制上呢， 这个进行创新，建立了每周召开推进会、每天编发简报、实时监控进度这样的工作模式，并且督促西安市下面呢有13个区县督促相关的区县、开发区还有产业园区工业园区，建立落实 复工单位派驻联系、信息日报和检查指导相关制度。第二个大的特点呢是缘起政策呢做到3个及时 一个呢是及时制定相关政策啊。早在2月8号呢，在疫情最为严重的时候啊，我们西安市出台了确保经济平稳增长的21条措施啊。那么这21条措施呢，这个发布之后呢，对解决企业存在的困难有很大的帮助。二呢，我们是在这个政策出台之后呢，及时进行解读和宣解啊，通过新闻发布会、政务新媒体等等渠道呢，及时的把中央、省上和西安市的缘起政策呢，对外界公布啊，提高呢这个企业对这个各种政策的知晓率和办事效率。三呢，我们是在这个政策的兑现上呢，这个确保及时确保及时，最大限度的支持企业呢复工复产啊。第三个大的方面的特点呢，就是我们在这个复工复产整个这样一个复杂的系统工程中呢，突出3个优先啊。第一个呢，就是优先推进产业链协同复工复产。在工作中，我们发挥龙头企业核心带动作用和影响力，引导产业链上下游配套企业，还有这个行业领域内的其他企业，进而辐射和带动相关行业领域的企业，就是说打通产业链的关键环节，采取一个龙头企业、一个产业链的方式，疏通关键环节上下游配套企业和集群中的骨干企业这个复工因为这个在这个产业过程中也是一个全国的大市场那么我们除了西安市内部的企业复工之外，我们也及时的与这个市外的政府部门联系让他们帮助涉及到给西安供应这个相关产业链的企业也能得到及时的复工。第二个方面呢，就是我们优先推进全市重点项目建设。我们实行每月一调度，每季一观摩，半年一考核这样一个工作程序。在3月份呢，我们保证了去年开工就是在今年是属于这个续建的196个建设项目全部复工。今年前3季度328个市级重点项目，共完成投资总量是2800多亿率先呢这个完成了全年的任务。第三个方面呢，我们优先推进这个就是关乎国计民生还有城市要素保障的，就是这2个重点企业的复工最终我们在2月底呢做到了所有的规模以上的工业企业，所有的民生保障企业你比如说水电气暖这些企业，还有我们所有的医疗物资保障企业各大医院呀，还有我们这个口罩消毒液、防护服等等这些企业，还有所有的室外的旅游景区这4个方面就是100%做到了复产复工。第4个方面大的特点呢，就是我们在服务保障中突出3个精准。一个呢就是精准的对接协调，设立了各种服务专线，24小时不间断的为企业提供政策咨询和服务保障，并且安排驻企这个工作人员深入重点企业，面对面的为企业解决实际问题。第二个呢，就是我们精准的解决企业提出的问题，针对企业提出的物资紧缺、 特别是防疫物资不足，还有用工难等等困难，我们积极推行一企业一政策，一个企业这个一个服务专班的这样一种这个服务机制迅速的帮助企业解决问题，特别是在疫情期间，这个针对邮件快递积压严重的问题，积极的协调使得我们这个全市的邮政快递的各个分支机构呢及其各个网点呢尽快完成了复工仅仅用了几天的时间呢，全市1313家邮政快递网络都做到了复工。第三个呢，就是我们精准的督导检查，建立健全企业复工复产的督导制度现场呢发现问题，为企业做好全方位的服务。我今天的发言呢就到这里我也欢迎我们各位国内外的朋友来西安旅游在这儿也祝大家一切安好，谢谢。
Thank you very much, Mr. Wang Hongbin from Xi'an. I think many cities in the world will want to inspire themselves from the types of actions that you have taken, especially to get business back online. And I think key takeaways here is flexibility, agility in response, effective communication, a regional approach where you are looking not just at your own city, but you're looking at surrounding cities to make sure that supply chains can come back online. And finally, what I was really struck by is the way that the city decided to look at its plans and its projects, to monitor them on a monthly basis and to evaluate them on a 6-monthly basis. I think that is really something that we need all to learn from, that effectively if we want to build back better, and here it's building back our livelihoods, our businesses, our enterprises, we need really closely monitor what is happening, monitor the effectiveness of ongoing projects and investments, and also be really flexible in our approach. Thank you so much for those inputs. We still have a little bit of time left. We did start a little bit late, so I'm begging the organizers that we still afford 10 to 15 minutes for questions and answers. So please, anybody who would like to ask a question of any of our panelists or have a comment to make, please just raise your hand on the, you have the possibility to wave on Zoom. Buddy? All right, if there are no comments or questions from the participants, I would like to then attempt to wrap up this very, very rich discussion we have had. I think the takeaways are very clear. We have several takeaways on how we need to rethink our city, how we need to rethink how we govern the city, how we plan the city, and also how we look at the institutional aspect. I think one very clear takeaway is that the old way of doing business, as Jose said and underscored, is at fault. The root cause is the fact that we have allowed silos to take over the way we administer things publicly, that we have focused on efficiency rather than effectiveness of what we're doing, and that we have basically neglected all of the signs that inequality was a looming threat to the resilience of an entire plenty. So I think these are some very key takeaways from what Jose was talking about. Mark, on the other hand, really gave us some possible images and visions of what rebuilding means. What does it mean to have a more equitable urban space? What does that mean in terms of distance to where you live, between where you live, where you shop, where you work, where you meet people, the 15-minute city of Paris, or the super blocks of Barcelona, where we take back public space that has been overtaken by the car, and we take it back to make it useful for people. And then, of course, the key question when we do rebuild back, and this I think is going to be critical in the months to come, if not the years to come, what should a city be doing to ensure that business can get back on its feet, right? And there, I think we have heard many of the measures that Xi'an has taken in order to do so. I would just like to conclude by saying that innovation, and I agree very much with what was said before by Octavie, that maybe we need to add the word creativity and risk-taking to the concept of innovation. I think we need to be able to dream a bit and dream what a COVID-proof or pandemic-proof city looks like. And I would like to share an image with you in conclusion, because I think it is a very compelling one. The Chinese government launched a design competition a few months ago, precisely on this issue. What should a post-COVID-19 city look like? And it's my honor and pleasure to announce that it was a Spanish architect, Vicente Gualat, who won the design competition. And I would like to share, if the screen sharing button works, what he envisaged as a pandemic-proof city. Basically, a few of first of all, it looks tremendously like a superblock, right? It looks like what Mark was talking about when he mentioned the transformation of the superblocks in Barcelona. Let's keep in mind that most of our cities remain to be built now until 2050. So a major preoccupation in rapidly urbanizing societies is how do we build new districts, new housing estates in a more resilient manner. And here what Vincent Golab has done is all of the apartments in this complex have a balcony that's facing south. All of the green space, as you can see, is in the middle and is protected from the streets around it, just like in a super block. And what you see here are greenhouses. So basically what happens is that this super block, up to 10,000 inhabitants, will be practically self-sufficient in terms of fruits and vegetables and daily necessities. And of course, the whole system will be based on recycling, reuse, etc. So basically, an image. And I think we need to dare to rethink utopia. We need to be able to reimagine what a livable city is, so that we are effectively more resilient and more capable of bouncing back from. With that, I would like to conclude today's session, thanking first and foremost all of our panelists, and big thanks to the city of Xi'an for sharing what they are doing in terms of their policies and strategies. Thank you, Emilia. Thank you, Octavie. Thank you, Mr. Gao, for having enabled and facilitated and opened up this session. And thank you all of the, I think, something like 64 participants that have listened in on this webinar. And let's replicate this in other spaces so that we can reach out to as many cities and as possible on as most of the Western world, where I am right now, is undergoing the second wave and needs desperately to learn the lessons from other cities. Thank you very much.
Thank you very much, Nicholas. I just want on behalf of Octavi and myself, but also you and Habitat, that I want to encourage the community of practice to participate actively in our cities, our listening experiences, so that we can build on some of the issues that you have shared now. We'll be very keen also to hear about the soft infrastructure of the city, some of the approaches that Xian has brought to us about dialogue with private sector, but also the importance of the food chain and food supply. I think will be very relevant for us to think about this new Utopia and redefining the utopia that you were inviting us to do. Thank you for your great job in this community of practice. Thank you, Guangzhou. And we hope to have your commitment to continue contributing to our thinking process. Very inspiring within the framework of our council. Join us on Friday to hear more about recovery. Thank you very much. And remember, colleagues, this afternoon we have the Committee on Culture, and we have also a special session on our municipal investment fund. So keep tuned. Thank you. Bye, Nicholas. Bye-bye, Guangzhou.
Thank you.
Bye. Gracias, José. Ciao.